Now to the part 2 of bone tumors. To continue, another group of type of benign bone tumor is the osteoid osteoma. Here at the proximal metaphysis of the femur, as we see in this X-ray. In the X-ray, we see usually a small nidus with sclerotic wall. The patient will complain of deep, boring pain at night, relieved by taking aspirin or salicylic acid, acetyl salicylic acid. Often it is difficult to see the osteoid osteoma in the simple X-ray view, normal X-ray view, so we need maybe CT scan or MRI view to demonstrate the tumor. And more than 75% of the lesions are found in long bones like the femur or humerus or tibia, and especially near a cortex. Here the osteoid osteoma is demonstrated in the CT scan or MRI. As we said, in the normal X-ray it is often difficult to see. Another type of benign tumor which is affecting young patients is the giant cell tumor, osteoclastoma. The name of osteoclastoma is old. Now mainly you find it in the references as giant cell tumor. It is a benign tumor affecting young people, end of long bones, like here at the distal end of the femur near the knee joint, extends to articular cartilage filled with giant cells. That's why we talk about giant cell tumor, because it contains of giant cells and blood. Tendency to malignancy by operative revisions. So if you decide to do operative management, you have to excise the tumor completely with soft tissue. Otherwise, by revision, by more than one operation, there is a high risk of tendency to malignancy. This is very important to know. Here's another picture of osteoclastoma or giant cell tumor at the end of the femur near the knee joint. And here we change to another group of bone tumors, which is the malignant bone tumor type, osteosarcoma, the most common malignant tumor. It arises from osteoblasts and metaphyseal plate of the long bone. It can occur in any age, and usually in the X-ray we find the so-called Codman's triangle and sun ray spicules. We see this is the typical sign of osteosarcoma. The prognosis is poor. Usually the patient die after few years. Another picture of osteosarcoma. The X-ray view shows typical spicules, sunrise spicules, and diffuse sclerosis of the affected bone. Another type of bone tumor which is highly malignant is the Ewing tumor or endothelioma. Ewing's tumor, highly malignant with subperiosteal reaction as we see here in the figure, stop and go ossification. The pain is typical pain, severe pain, swelling and pathological fracture can occur. Here also another X-ray view which demonstrates Ewing sarcoma at the upper part of the femur near the hip joint from the reticulum cells of the bone marrow arising. X-ray view showing a typical onion skin and stop and go ossification. Another type of malignant bone tumors is the chondrosarcoma. It's happen in older age. The male are affected more twice as the female patients. High alkaline phosphatase we can find, and usually the patient will need an amputation of the distal part of the bone. Another type of malignant bone tumor which is very bad is the plasmacytoma arising from the bone marrow cells with progressive development, very bad prognosis. Usually we use radiotherapy and chemotherapy, but with bad prognosis. After that we have the secondary malignant bone tumors, so we call them the osteolytic metastasis by hypernephrotic carcinoma and typical pathological spontaneous fracture with bad result. Secondary bone tumors, malignant bone tumors, can arise from the chest, from the lungs, stomach, kidney, maybe prostate, thyroid, breast cancer, cervical cancer, or maybe from the skin. At the end of this talk, small notes about the management. Investigations are done with laboratory or X-ray, scintigraphy, or biopsy of bone tissue. The treatment can be surgical, it means amputation or excision, chemotherapy, radiotherapy, later on physical therapy and rehabilitation. So that was the second part of bone tumors. Thank you for your attention. Nice to meet you, and I hope to see you in another topic of the orthopedic surgery. Thank you. Bye bye.